Thank you, Mr. Chairman, very much. Let me just begin by saying that LGBTQ people are living in a national state of emergency. More than 1 in 2 transgender and non-binary youth have seriously considered attempting suicide. When elected officials use their bully pulpit to target gender-affirming care, create barriers to evidence-based life-saving treatment, and fuel the fire of the youth mental health crisis, this is a driving force in a nationwide campaign of discrimination, and it is unacceptable. To LGBTQ youth, young people, let me just say this very clearly: trans rights are human rights. And I'm never going to stop fighting for essential research and investments in the care which you need to make sure that everyone is free to exist as their authentic selves, and we won't rest until you are free to live openly, authentically, and safely. Doctor, thank you for being here today. I've heard from many people in Massachusetts, including many oncologists, about your excellent work and your leadership. And it's clear that you have a commitment to public investment to drive research that will improve Americans' health, treat illness, and to cure disease. Last year, Congress passed my bipartisan Children in Media Research Advancement Act, requiring the National Institutes of Health to conduct research on technology and media's effects on infants, children, and adolescents, and provided the NIH with $15 million to launch this program. We already know that big tech's exploitation of younger users is driving a mental health crisis, and this research will further document the serious harms caused by the online platform's insatiable appetite for children and teens' personal information. Doctor, if confirmed, will you commit to prioritizing that research? We have an epidemic, a mental health epidemic amongst teens and adolescents in America.
Thank you, Senator Markey. As the parent of very recently teenagers, I can certainly comment to a great concern about the amount of time spent in front of computers and worry of a parent as to what that really is doing. I can commit to you that this is a very important issue for NIH research, understanding what this new technology means for our young people, really everyone, but certainly more of a focus on the young. I also know that this is an issue that is a great concern for our Surgeon General, and I also look forward to working with others across HHS on this issue.
You know, the Surgeon General has identified the problem. Senator Cassidy and I already have, coming out of the Commerce Committee successfully, an upgrade of the protections for kids online up to age 17, and we're hoping to move that on the Senate floor. But we also need the documentation from NIH as to the underlying pathology which is being created as we sit here right now. Since the passage of the National Alzheimer's Plan Act and Alzheimer's Accountability and Investment Act that Senator Collins and Senator Warner and I have worked on, NIH research has contributed to significant advancements to understand and treat Alzheimer's, yet we have a ways to go. We are just beginning to understand the impact of air pollution and environmental justice on the brain. Black, brown, disabled, and rural Americans face discrimination and other barriers to access to treatment, including expensive treatments or long travel times to care. And family caregivers still struggle every day with providing care to their loved ones with Alzheimer's. Doctor, can you just tell us how you view the NIH's role in continuing to lead Alzheimer's research in new directions, center equity and access, and support the family caregivers who are so often at the front lines of providing care?
Thank you so much, Senator, for that question. You know, it raises many issues that I'll just go back to maybe my core approach to things such as this. First, understanding the biology of what produces this condition. And that means going all the way back, maybe even into very early years of life, so that we can think about prevention rather than treatment. That's really critical, and encompassing a very broad population of people to inform that. Next, though, dealing with what we have today. people who are really suffering, families for which this is a tremendous burden and having difficulties. Developing new treatments that can work now for people suffering from the disease. And as you've already said, it is part of NIH to think about care delivery, and that means delivering for the caregivers, taking care of the caregivers, because they're a really important part of what helps us achieve health.
Thank you. And again, our goal is to continue to increase funding for NIH. Research is medicine's field of dreams, from which we harvest the findings that will give hope to families that we can find a cure for Alzheimer's. And NIH is really the National Institutes of Hope for all those Alzheimer's families. Thank you. Thank you, Mr. Chairman.